Morning, everyone. I'm Hartford HealthCare's Tina Verona. Thank you so much for joining us on this Thursday morning for another briefing. We do have our normal guests, and we also have someone new. Of course, we have with us Dr. Ajay Kumar, our Chief Clinical Officer, as well as Dr. Ulysses Wu, Chief of Infectious Disease for Hartford HealthCare, and really happy to be joined today by Dr. Jim O'Day. He's the Vice President of the Behavioral Health Network here at Hartford HealthCare. As always, we turn it over to Dr. Kumar first to give us the latest data across Hartford HealthCare. Dr. Kumar.
Thank you. Thank you, Tina, and good morning, everybody. Hartford HealthCare continues to see patients who are admitted with COVID as a diagnosis or as an incidental diagnosis at this time. We have today, Rob, can you mute yourself, please?
Yeah. I got a booster button.
Thank you, Rob. We have 535 patients across the Hartford HealthCare. That includes our one of the behavioral health facility as well, Nanchang Hospital. Bacchus Hospital has 52 patients. Charlotte Hungerford has 46 patients. Hartford Hospital has 230 patients. Mid-State Medical Center has 42 patients. Nanchang has 10. St. Vincent Medical Center has 69 patients. Hospital Center Connecticut has 69 patients, and Wyndham Hospital has 17 patients. Number of patients who are in ICU today are 67. Number of patients who are requiring vent who has COVID as a diagnosis is 50 today. We continue to see some increase in our numbers, and one of the refreshing news yesterday, the state presented a slight decline in total hospitalization across the state of Connecticut. And I do want to highlight, as we discussed yesterday, many of those patients are seeking care because of underlying conditions or some ongoing medical issues, and they happen to have COVID because we test everybody who comes to the hospital to make sure our colleagues are safe and we're providing a safe care to our patients as well. There's a lot to discuss today, but I'm really excited to pass the baton to Tina because Jim will share some really interesting observations and his thinking around from behavioral health perspective. Thank you.
Yes, thank you, Dr. Kumar. I want to give it to you, Dr. Wu, next to see any updates and as far as the epidemiology and where we stand.
Yeah, I think I want to reiterate again what Dr. Kumar had said. You know, one day does not make a trend. So even though, Tracy, I know you're going to ask me these later, so I'm just going to give you the numbers right off the bat. So the state is +5 for ventilators, and they're going to be +36 for ICU. But the good message is that for the first time in a long time, we've had a decline of -22 for hospitalizations across the state, as Dr. Kumar had alluded to. And so, again, one day does not make a trend, but if the ICU and the ventilators usually tend to lag hospitalizations, we're hoping those numbers go down in the next week or so. But even though we talked about it yesterday, that we can't really do microscopic epidemiology. I love that term. I'm going to use it so much now. And we can't make predictions from day to day exactly what the exact day is going to be. I think if you take the 1,000-foot overview, you're starting to see, again, a decrease in the rise, in the rate of rise. And that's very important. So if you look at it like we're riding a roller coaster, we're maybe nearing the top at this point for at least this curve at this point. So I'll stop there.
All right, thank you, Dr. Wu. And I do want to bring in Dr. Jim O'Day, our Vice President of the Behavioral Health Network for Hartford HealthCare. Dr. O'Day, this pandemic has really caused a lot of issues for mental health by way of those who've had mental health issues and even those who haven't. Let's talk about the access to the care that we are providing for mental health across Hartford HealthCare. And thank you for joining us.
2 years, you think you would go off mute. Good morning, everyone. And Tina, thank you. I'm really proud to join my colleagues, Drs. Kumar and Wu, in the presentation here this morning. It's very true. And just what Tina said, the impact on the pandemic has resulted now in another pandemic, and it's the mental health pandemic. And we knew this was coming, and we're prepared for it. I want to start actually first by thanking and recognizing all of the behavioral health professionals at Hartford HealthCare, as well as all of the other behavioral health professionals around the state and the country. People are putting in extraordinary efforts, our psychiatrists, our psychologists, our social workers and nurses. all of the teams that are supporting our folks in our communities with mental health concerns are working extraordinarily hard. And I'm so proud to be among them and count them as colleagues. I'm going to start with stating the obvious. The impact of the pandemic has disrupted people's lives in innumerable ways, almost an infinite number of ways. And when we see significant changes in people's lives, it's not going to be a surprise that we're going to see a disruption in their mental well-being. And so I think it's been well documented that there is an explosion in mental health concerns and substance abuse related issues as a result of the pandemic. That's sort of the obvious thing that many people are talking about. I'd actually like, however, to bring attention to something that perhaps is maybe a little bit less obvious, which is long before the pandemic, there were vast, insufficiently treated mental health concerns in this country, not just here in Connecticut, but throughout my whole 30-year career. So the data is really clear. For every 10 people who have a treatable behavioral health condition, less than 4 are receiving evidence-based care. Think about that for a second. We have nothing on that same order with cardiovascular disease, with cancer, with digestive health. Fully 60% of the people who have a treatable mental health condition were not receiving care for it. And the impact of that is dramatic. It's hundreds of millions of dollars on unnecessary costs, disruption in people's work lives and their family lives, as well as the societal impact on not treating what are very treatable conditions. And then moreover, when people have untreated psychiatric conditions, it makes their ability to maintain their treatment for their diabetes, for their heart failure, for their other conditions worse. So untreated mental health issues are a major problem. They were a major problem before, and it's now worse during the pandemic. Let me highlight 2 other short notes before I respond to any questions that come up. It is particularly troublesome what I just said, because for the most part, these are very treatable conditions. People with depression, people with anxiety, people with post-traumatic stress disorder, these are conditions that we have evidence-based care for, and the vast majority of people who get treatment for these conditions get better. So to me, I think there's a moment here in front of us where we can put these 2 facts together. The pandemic and now the subsequent mental health pandemic has illuminated an issue that we knew was there before, and it's more significant now. But that awareness and the knowledge that these are really treatable conditions creates such an opportunity for us to say, let's get people into care and treatment. And I'm so proud of the work that we've done at Hartford HealthCare and other behavioral health agencies in providing many channels of how people can get care and treatment. We've shifted dramatically to providing telehealth and virtual care throughout our organization, but there are more channels and access to behavioral health care now than there were ever before. So I really want to highlight in closing, these are very treatable conditions. They've always been there. Right now, I think we have an opportunity to amplify and further illuminate that these are issues that we want people to get care for. And there's a lot of ways to access care and treatment for these very treatable conditions. So let me pause there and see if there's any questions. I saw a lot of things. I can't read the chat while I was talking, but I'm happy to respond to any questions that people may have.
Dr. O'Day, thank you for that synopsis. A very important topic, and we're happy to address that in today's briefing. I do want to open it up now to questions from the media. The first one I see from Tony Terzi at Fox 61. Hi, Tony. Nice to see you. Staffing levels system-wide. Dr. Kumar, do you want to take that?
Yes, thank you, Tina. Tony, our staffing is stretched at this time, given where we are right now. But I do want to remind the Hartford HealthCare is a strong 30,000 people healthcare system which supports the needs of the community. And we have redeployed our individuals from our support staff services, such as IT and finance and revenue cycle and many other areas to support our clinical settings right now. The focus of entire system in our incident command has been providing access to the patient, make sure that all the patients get the access and the care they deserve at this time. So all the stress we're managing well at this time, and we continue to see the stress over the next week or two. We continue to have a lot of individuals who have been exposed or have been unfortunately turned positive with the COVID, come back to the system after a period of stay. A lot of our colleagues are working extra hours. They're actually doing double shifts and they're doing extra work. So at this time, we don't see any decrease in access for the community for any care. So we're managing okay at the moment with some stress. If I could take, Tony, your next question as well, because I was reading ahead, any need for temporary field hospitals? We don't think at this time is needed. As Dr. Willis has talked about, we are seeing hopefully near the peak right now, and we continue to have a fair amount of capacity across the state to manage that. And I don't think Hartford HealthCare would need that assistance at this time.
All right, our next question comes from Patty and Rob from the Associated Press. Can you address the challenges in getting patients from acute care to nursing homes and long-term care and how those are being addressed?
If I could take that, Tina, because I've been paying attention to this number.
Yep, go ahead.
So I do want to acknowledge that just like acute hospitals, nursing homes, and long-term facilities are seeing the same challenges with staffing. So I'm very empathetic to the fact that they are struggling in the same way as many others are with the staffing level. It has created some impact on transitions of our patients. However, it's been met, we've got a regular dialogue with our SNF partners, and we are working through this at this time. I do want to acknowledge the state, DPH especially, has been extremely supportive, and they've been very proactive in supporting this acute hospitals and working with the SNFs as well. And I do want to compliment the state's effort on that part here as well.
Our next question comes from Lisa Carberg at WTNH Channel 8. Thanks for joining, Lisa. How can people avoid getting a fake at-home COVID test? Any idea if this is a big problem? Dr. Wu, do you want to take that?
Yeah, I think we are seeing fake, I'll just say things, whether it be tests, whether it be masks, whether it be treatments, whatever it may be. And the best thing I can say is that you always want to buy from a reputable company. So I would say something major, like a major pharmacy, or even if you do try to buy these on Amazon, that you want to get it through their, I don't want to say preferred, but through their verified marketplace, as opposed to somebody that may be random on the internet. So that's probably the best way.
All right, Dr. O'Day, this next question is for you from Tracy O'Shaughnessy at the Waterbury Republican American. While clearly many people are not being treated for behavioral health, many people are being treated for these conditions, depression, anxiety, etc. And the pandemic has nevertheless put them over the edge. Can you address that, talk a little bit more, or expand on that?
I'm happy to do that. And thank you for that question, Tracy, as well as your follow-up question. I'm going to cover both of those. I'll also say that I'm a proud person who was raised in Waterbury, Connecticut for the better part of my young life. So I'm happy to speak to your newspaper. Yeah, Tracy, it's true that those people, so there are people who prior to the pandemic had no real significant psychiatric concern. And we have seen exactly what you're saying. There is a more vulnerable population. So if there are people that were struggling with substance abuse issues before, long before the pandemic, have we seen those circumstances become worse for them? The answer is a loud yes. People who have predisposition for these kind of risks, whether they were treated for depression, a substance abuse issue, an anxiety issue, these additional stressors have definitely resulted in those people having a more difficult time. That's the bad news. The good news is those people who have been involved with a treatment provider in the past, what I would highlight is if you're a person who's at a little bit more greater risk, let's make sure that you engage with your mental health professional, your primary care doctor, so you stay ahead of this issue. Because it is true that those with increased vulnerability have had more difficulties during this time. That's especially true, parenthetically, on the substance abuse side, is those people who maybe had been dealing pretty effectively with a recurring illness like alcoholism. We've seen that really become difficult. Some of that is associated with the social isolation, the absence of, until recently, being able to go to group-oriented meetings like AA. The pandemic has really impacted on many of the resources that are typically available for people with these kind of conditions. And if I may, Tracy, I'd like to follow up on your next question. I really appreciate that because I have a pretty strong opinion about this. This issue of frustration and futility, because what people keep talking about as the changing guidelines, it keeps changing and it's frustrating. My view on this is frankly a little bit different. I don't see these as changing guidelines. I see this as an evolving science. And where we were 2 years ago and our knowledge of the pandemic and the way to take care of people with these conditions has evolved, and it will continue to evolve. And so the expectation that, oh, first you told me I needed this and now I have to get that, or this works, but now you change your mind. It's not we're changing our mind as scientists. Medicine evolves. And with new data and new information, we provide new guidance that I think really can be helpful to folks. So I would ask folks to be a little bit recognizing we don't take care of many health conditions today the same way we did 10 years ago, and we celebrate that. So I don't think of these as shifting guidelines as much as I do evolving science.
Thank you, Dr. O'Day, for taking Tracy's second question as well. Our next question again from Tony from Fox 61. What is data suggesting as to when the surge will peak? Tony, we did have Professor Dimitris Bertsimas from MIT on yesterday who talked all about predictive modeling in terms of when it will peak in COVID. I will definitely make sure that you get a link to that. But in the meantime, Dr. Wu, do you want to talk about the data suggesting when this will peak and your thoughts?
Yeah, that goes back to the term, the microscopic prediction of the epidemiology at this point. MIT is suggesting that possibly later in 3 to 4 weeks. I'm actually more optimistic, as I mentioned the analogy with the or the metaphor of the roller coaster, that the rate of rise seems to be slowing down. So I do believe that we'll be coming around the corner at this point. And so I'm still hoping by Monday. So, you know, I've always said mid-January. By Monday, the cases will start decreasing. Hopefully hospitalizations will start decreasing. And remember that ventilators and ICU utilization tends to lag by 7 to 10 days. So I would expect that would start coming down. You know, we talked about January 21st. So again, that's a weekend. So maybe January 23rd. That is the hope. But again, if you take out the microscopic and you look at the macroscopic, I think the MIT models and our modeling is for the most part similar when you take a larger view of this. We do obviously have to worry about Omicron, which is here, but I think we're going to see more of a percent positivity outside of the hospital with some flow over into the hospital, and then influenza. But as we've talked about on previous briefings, the influenza numbers seem to be better, but it doesn't mean that we're out of the woods with influenza either.
Dr. Wu, thank you for that. Our next question comes from Mike Savino, WFSB Channel 3. Overdose deaths continue to rise through the pandemic. Can we assume the pandemic is part of that rise? Dr. O'Day?
Yeah, thank you, Mike, for that question. Yes, the answer is clearly yes. The stress and turmoil and social isolation secondary to the pandemic is absolutely in part contributing to the very significant rise in overdose and overdose deaths. I would highlight, however, 2 or 3 other points that I think are important to highlight. First is we're not dealing with the same substance abuse set of issues today as we were dealing with even as recently as 2 years ago. The level of fentanyl that is available in our community right now is devastating. And the impact of these illicit substances that are dominating folks who do have these treatable but chronic conditions has been devastating. So I would highlight a couple things. I think fentanyl has made it much, much worse. The other part, though, that I think is I want to highlight again, treatable conditions. And I would also say that if you have a loved one, somebody that you care about that has dealt with an opioid issue in the past, you should absolutely have Narcan in your house. These are really effective medication interventions. You hope to not have to use them, but in the event that someone relapses and you have a life-saving intervention available in your medicine cabinet that is virtually no risk, it should be something that you go and you can get it from your pharmacist. You don't even need to get a prescription now to get Narcan. You get it from your doctor, you can go to a pharmacist, But if you or a loved one has dealt with a narcotic issue, opioid dependency in the past, I would say that 100% you should have Narcan in your house. It is a simple administered medicine and it saves lives every day.
Continuing on with the mental health theme, our next question comes from Jordan Fenster, Hearst, Connecticut Media. Do you think COVID fatigue is related to mental health concerns, the exhaustion, the choice to not wear a mask or socially distance? Is it an effort to preserve some mental health stability? Dr. O'Day?
Yeah, thank you for that question, Jordan. And again, the answer is clearly yes. You know, this has been a devastating time in this country, and the length of this pandemic and all of the disruption that has put into our personal lives has been devastating. And this is why I think we will continue, not for the next couple months, but I think actually we will see for several years a mental health pandemic after this pandemic, because we're illuminating issues that are stress and turmoil. It's resulted in sleep disturbance and appetite disturbance and levels of depression. And the other thing that happens is people stop doing the things that work. So there are some basic lifestyle issues around making sure you appropriately take care of your sleep hygiene, that you eat a decent diet, that you find new ways to exercise rather than going to fully populated gyms. But there are coping strategies that I want to encourage people to continue to say, what worked for me in the past, and how do I continue to get those skills into my life? I'll use one final example. Social isolation has been very, very difficult. And I think, you know, I'll give this example. Would I have ever thought in a million years that my 91-year-old father would be on a Zoom meeting so that he could see his grandchildren and his great-grandchild? The answer would be no. But there are new ways for us to deal with social isolation using some of the resources that we have available now. And so I think we have to really focus on combating social isolation, but in new and different ways.
Thank you for that. The residual effects of the pandemic and mental health will certainly be a long road. Dr. O'Day, thank you for allowing some of those solutions too and sharing that. Dr. Wu, a question comes from Pat Eaton-Robb from the AP. Any idea the percentage of patients in for COVID versus whose other conditions have been impacted by COVID versus those who incidentally tested positive while in the hospital for something else?
I don't think I can answer the middle question, but I can give you a gross overview of the percentage of patients that are in for COVID is probably about 70%. We're talking about our COVID positives, not the total census. So out of all the COVID positives, about 70% are probably in for COVID, but 30% of them were incidentally tested positive while in the hospital for something else. And then if you take the gross overview of it, it makes the numbers in the hospital seem actually a lot better because the burden is not being placed on the COVID units and for COVID care. So I don't know, Dr. Kumar, I don't know if you know about the conditions, people who have been admitted for other conditions, but the COVID has impacted them.
I think it's really important to note that the COVID diagnosis in itself, even incidental, does put a stress on our teams in the sense of how we manage the patient. The resource requirements are different, isolation requirements, and things like that. But at the same time, there is obviously the science will evolve over time, but there is a concern among the scientific community that COVID, underlying diagnosis of COVID may impact the recovery as well for other conditions as well, and complications could be higher. So, COVID needs to be taken seriously, irrespective whether it's incidental or not. But for the media to know that sometimes the data, as we have looked so far from the beginning of pandemic, where we are focused on hospitalization as an isolated data point, this is different today. What we are seeing is a lot of community or outpatient COVID management. The COVID management, which is happening through virtual health, medical group, through our behavioral health, through our other urgent care and other centers right now, and emergency rooms right now. We have got a lot more patients who are managed outside the hospital than in the hospital. And there's a good possibility as the pandemic proceeds that we will have a large number of community who would have been exposed, have been positive with COVID, are seeking hospital care for unrelated conditions. So as we represent the hospital numbers, it could be misleading at times. It does not clearly advised the impact of COVID on hospital stress at this time. I think what's more important to think about, what is the positivity in the community at the moment? How many folks are turning positive? How we are making sure the mortality is reduced, number of people who are vaccinated, who are requiring hospital stay versus unvaccinated. I think these are the important metrics to focus on. And that's one of the reasons I keep underlying, keep focusing on the data that hospitalization right now is happening for patients, all the patients, but we are intently checking everybody's PCR at the moment. And we've got some of the people who come for broken legs or cellulitis or things like that, or mental health issues, or having a baby, but they happen to have a COVID. And we're managing that as well. I hope that answers your questions.
Our next question comes from Mike at Channel 3 about Omicron parties and people getting together, hoping to catch the virus together, given that the strain appears to be more mild. Does this become a safe way to build natural immunity, or is it dangerous, Dr. Wu?
I can't believe we're actually going to talk about this.
Ulysses, make it simple. It's a bad idea.
Right.
It is. But I do want to address the point of herd immunity. So we know that herd immunity is not long lasting. And we also know that from our original coronaviruses before COVID-19, that's why you get sick from year to year to year. It's just not a good idea. But the most important reason is, yes, you may do well, but you can give it to somebody who may not do well. And that is the most important thing that we really need to realize about this pandemic.
Thank you. Eliza Fawcett from the Hartford Current. This question is for you, Dr. O'Day. A few questions here. How has the increased demand for mental health care strained Connecticut's healthcare system? Are there wait times for behavioral health care at Hartford HealthCare, and to what extent can people who need higher levels of behavioral health care obtain it?
Yeah, Eliza, thank you for that question. Let me talk about both at Hartford HealthCare, but really through the entire hospital system of Connecticut. We have worked very closely with the Connecticut Hospital Association to stand up a variety of incident command structures and other resources as a way to monitor and manage the demand for care across all of our settings. At Hartford HealthCare, we're the largest behavioral health entity in the state of Connecticut. Frankly, we're probably one of the largest, if not the largest, in New England and the mid-Atlantic states. Every morning, we pay attention to what's happening in our emergency departments. On any given day, we have well over 275 to 300 people in inpatient care for people who are really struggling with a pretty significant episode of the illness. But on any given day, we're able to both discharge enough people to admit other folks who come into the emergency department who need and are seeking inpatient care. We monitor this data very closely at Hartford HealthCare, and we have the luxury and the benefit of having invested so much in behavioral health for so long. We've got an array of assets across the continuum that we're able to take care of children, adolescents, adults, and older adults. So I think we're very comfortable that we're able to provide access to those kind of services for the folks who need them. And working with the rest of our partners in the Connecticut Hospital Association, we've done a lot of coordination with state agencies to make sure that we are able to meet the needs of the folks in Connecticut.
Our next question is for Mike at Channel 3. Dr. O'Day, continuing on the mental health theme, telehealth. How is it or isn't helping people in isolation get treatment? Are people taking advantage of it? And is it proving to be effective in the mental health realm?
Yeah, it's a great question, Mike. And the answer is a little bit nuanced. I would have earlier said something like it's the greatest thing and there's no downside. That's not the case. There are certain populations of people that do very, very well with telehealth, and it's really important that we have it as an avenue of care. We've also found, however, that there are certain communities that the virtual solution is not the best solution for them. I'm particularly highlighting folks with post-traumatic stress disorder. People with post-traumatic stress disorder and those kind of intense anxiety-related symptoms really do benefit more from face-to-face care. The same is true with people with substance use conditions. Substance use conditions, some people can benefit from telehealth. So I think what we really have to do is take an individualized approach. What might be a really good solution for Jim O'Day might not be exactly the right solution for Tina Verona. And it's the responsibility of the behavioral health professional to work with that patient and say, I have a number of different avenues to provide you care. Let's select the right one for you.
Going back to Tracy, Dr. O'Day, another question for you. Many people struggling with mental health issues have been stymied by a lack of beds to treat them. Could you address that? And then we'll get to the second question for Dr. Kumar, but let's have you address that first.
Again, I actually feel like we have sufficient resources. I'm a little bit, frankly, more concerned less about the beds. There is a preoccupation with beds, and I think that's an important, but I would highlight the idea that inpatient care typically is a rather short-term intervention for people who are quite acutely ill, just like in medicine. And so some people may need an inpatient level of care. I think it's important that across the state, we work harder to build up more ambulatory services, not just in traditional settings, but just to highlight some of the innovative things that we've done. In our primary care practices, we've got probably somewhere between 40 and 50 behavioral health professionals who don't work in a behavioral health setting. They work in a primary care clinic, working together with a treatment team and a primary care doctor. So I think, there's no wrong door. We need to make sure that we're promoting access on the ambulatory side, because when people get early access to treatment, they're less likely to need to be on an inpatient setting.
Next question from Tracy, whether Hartford HealthCare was considering expanding behavioral health facilities in 6 to 8 months. If so, can you say more about that, Dr. Kumar?
Tina, if I could actually ask Jim to comment on two of the questions which Tracy's posed. Are you larger than the behavioral health and then the Institute of Living, and this particular question, and after that we can go to Dr. Wu in the interest of time. Thank you.
Well, we're working together with our state partners, the Department of Social Services, the Governor's Office, and OPM. We are going to expand inpatient services for child adolescents. There is an unmet need at the present time. Some of that is the result of probably over a decade ago, people sort of closed some of their access to inpatient care. We've maintained all of our child adolescent beds in all of our settings at Natchog Hospital, at the Institute of Living, in our St. Vincent's campus, but we will be adding additional beds to make sure that we're able to meet the needs of the youth that are struggling with these kind of issues. And then further, we are also going to be adding more beds for folks with addiction and addiction psych issues. That there is an insufficient capacity for people who need medically managed withdrawal treatment and what is known as residential rehab. So we will be standing up more services to meet the needs of those folks as well.
Jim, if you can describe the extent of behavioral health network for the viewers, because Tracy's question has piqued my anxiety that maybe folks don't understand behavioral health from Hartford HealthCare.
Yeah, sure. I'll do that quickly. So as I said earlier, we're the largest behavioral health system in the Northeast and the Mid-Atlantic states. We have well over 330 inpatient beds. We have nearly 160 beds for people with substance abuse related conditions. But we also have as many as 45 locations across the state of Connecticut in all of our geographies, all the way from up in Torrington, where we provide state-of-the-art child adolescent ambulatory services, all the way over to Groton, that is run through our Natchog program. So the Behavioral Health Network has as many as 50 different locations providing a comprehensive level of care. Just for example, prior to the pandemic, we probably on an outpatient basis provided as much as 750,000 visits in just our outpatient clinics alone.
Next question, Tracy, also as a follow-up. When it comes to herd immunity, the concept of herd immunity, if it's long-lasting, or is that concept out the window?
Yeah, I'll take that, Dr. Kumar. We've never really believed in the concept of herd immunity for this disease. Herd immunity does exist for other things, and we always remember the chickenpox parties, because for chickenpox, it is long-lasting immunity. And amongst other viruses as well. But for this, we've always known that coronaviruses, even though we don't routinely test for it, before the onset of COVID-19, you would always have your common cold. That common cold was usually due to a number of respiratory viruses, some which included coronaviruses. And if there was long-lasting immunity to the common cold, we wouldn't get that common cold every year. So we've always known that there was really no concept of herd immunity when it came to a disease such as the coronavirus. So we never threw it out the window because it was never in the car or the house.
Go ahead. Our next question is from a viewer. I do want to make sure we ask a viewer question, asking about a well-controlled type diabetes versus type 2 diabetes. Who is more impacted or at risk to have a bad situation with COVID? Dr. Wu?
Could you read that again? I'm sorry,
Yeah,
I was looking
sure.
for it and I realized it's a viewer question, so it's not in the chat.
Yes, it's a viewer question about well-controlled type diabetes versus type 2 diabetes. Who is more impacted or at risk to have a bad situation with COVID?
It depends on the extent of the type 2 diabetes, whether or not that is well controlled. So if you have type 1 or type 2, and you are well controlled, that is going to much lower your risk for complication from COVID. If you have uncontrolled for either, it is going to increase your risk. I hope I answered the question.
Okay, thank you. I don't see any other questions in the chat. At this time, we are a little bit over. I do want to allow some time for final thoughts. Dr. Wu, do you want to start? Final thoughts today?
Yeah, absolutely. Tracy, just to comment on Tracy's threshold of 65% or so for herd immunity, I don't think it was for herd immunity. I think it was for vaccination, in addition to herd immunity. I think that's what he was quoting. And remember, that was a moving target. We've always maintained we would like a 90% vaccination to really help with the pandemic. Unfortunately, we're not at that. So my final thoughts, not much different from the day before. We're analyzing the data. We want everybody to be safe. We want everybody to institute the right measures to keep themselves protected. A couple questions have come up about the parties and herd immunity. You have to remember that this is a societal consequence. This is a disease with societal consequence. It is not a disease that is particular just to yourself. You can give it to other people. Those other people may not do well, and we have to be very cognizant of that. That's it.
Thank you, Dr. Wu. Appreciate that. And Dr. O'Day, lots of questions for you today. So obviously, very much worthwhile to have you join us. Final thoughts on mental health.
Yeah, well, first off, I want to thank all of these questions. I think this is a compelling issue at this time. And so I think the interest in the topic doesn't surprise me because what's happening in all of our families and in our communities. And I would just continue to highlight, these two issues. Less people get care than we want. And that these are very treatable conditions. And so if you think you are suffering from this, or someone who you care about is suffering from any of these kind of conditions, please encourage them to reach out for help because treatment is very effective.
And is available. The access is available. It's there.
That's correct.
Dr. O'Day, thank you. And Dr. Kumar, your final thoughts.
Thank you, Tina. So I do want to remind all the listeners, in the middle of the raging pandemic, Hartford HealthCare continues to assess the need for patients from a holistic point of view. We have focused on increasing an outpatient access through virtual care, whether it's medical group or behavioral health, access in our urgent care centers, emergency rooms have been providing a lot of tremendous care right now. Our hospitals obviously always continues to serve. But at the same time, we are also just deploying monoclonal antibody, Paxlovid, and other medications to manage the pandemic. So our increasing testing through the increasing number of trailers. So in this raging pandemic, we are there with you to support the need for the community. And we are leaving no resources unutilized at the moment across the Hartford HealthCare to make sure the community gets the best care and the access they need and deserve at this time. And I'm hoping that we are going to be over this soon, and we're going to come out stronger and better after that. Thank you.
Thank you, Dr. Kumar. And as always, thank you all for joining us today and for the really great questions for our panelists today. For Dr. Wu, Dr. O'Day, Dr. Kumar, I'm Hartford HealthCare's Tina Verona. Thanks for watching. We'll see you all again tomorrow.